Hello, this is Ioanna Kontari from Athens, Greece.
Pleased to share with you this very interesting case. This is a post-LASIK ectasia case. You can see here the epithelial remodeling around the ectasia point. This is the anterior segment OCT. You can see in the cross-section of the flap also foreign body, very prominent foreign body left behind during the initial LASIK procedure, of which we do not have much information. This young patient came to us with reduction of his visual acuity 3 years after his original LASIK procedure. On the pentagram here you can see the clear inferior steepening, thinning of the cornea. On the placido disc topography, the iatrogenic keratoconus is very obvious. This is the foreign body left behind the flap. This is 3 years after his LASIK procedure, performed here in Athens. This is our intraoperative images with the X500 excimer laser using a Sinskey hook to relift the flap. Special care taken not to create strands of epithelium that can dive into the interface and create epithelial ingrowth. We're going to lift the flap quite easily. Come here with the dry Wexel sponge and remove that probably a piece of lint left behind during the original procedure. Now employ a topography-guided treatment in order to normalize the ectatic cornea. This is the topography-guided treatment with 0 refraction, and this is with the actual refraction, which was plus 0.75, minus 125 at 38 degrees. You can see the clinical on the top. This is the laser treatment. Of course, we used our known TMR technique in this case. Numbers that we've used in Athens protocol cases, although this is not an Athens protocol case, this is a in the flap treatment. We're using here Vibex Extra, which is 0.25% riboflavin solution, so much higher concentration than the one used in the standard Dresden protocol. We're going to carefully not expose the underside of the flap and soak for a total of 120 seconds, so 2 minutes soaking. And after that, remove the excess riboflavin. The reason being is we want to have minimal riboflavin exposure of the flap, on the underside of the flap. Put the flap back on, rinse as if the case would conclude here. Then use suspension steroid to delineate the gutter, and we're going to see a Johnson apponator used here to iron the flap back into place. Pressure to move the central wrinkles to the side, a wet Wexel to iron out the flap, and here using the KXL1 device, 30 milliwatt fluence for a total of 3 minutes and 20 seconds to deliver 6 joules of energy. And here the postoperative image showing the cross-linking hyperreflectivity in the interface, the area where that foreign body was removed. And these are the epithelial maps and total cornea thickness maps. After the in the flap topo-guided and higher fluence cross-linking, we can see the marked normalization of the cornea, pre-op on the left, post-op in the middle, and the difference map showing the high level of efficacy achieved with the topography-guided platform by Wavelight, the X500 laser. Similar result to our Athens protocol data reported many times in the past, but the key thing here is that we use very high fluence CXL to perform a through the flap cross-linking procedure. Again, before and after, a patient was able to achieve 20/20 visual acuity with a minute refraction plus 0.25 minus half at 75 degrees, and again, so we can see here in focus the topometric indices improvement, mainly the IHD. Last image, the post-op external image, center here in Athens, showing you a through the flap topo-guided treatment of post-LASIK ectasia and higher fluence cross-linking, very successful result. Thank you very much for your attention.